Namaste everybody, this is your Dr. Sargam Soni. Thank you so much for such amazing and overwhelming response to all my previous videos. I am in immense gratitude to each one of you for the same. If you haven't yet subscribed to my YouTube channel, please subscribe to my YouTube channel. Click the bell icon to stay updated. If you like any video, please like. Your comments are precious. You can feel free to share them if you think they're going to help others. So today, I am back again with another interesting topic, which is the urinary tract infection. Before I start talking about urinary tract infections, let me help you and tell you a little about what exactly infections mean. So infections are basically invasion or attack and subsequent multiplication of the harmful or the pathogenic or the disease-causing organisms in a human body. These pathogenic or disease-causing organisms are primarily bacteria, viruses, fungi and protozoa, and out of all of this, the commonest ones are bacterial infections. Now let's come to urinary tract infections. What is the incidence of urinary tract infection? At the age of up to 11 years, almost 1% of the boys and 3% of the girls have incidence of urinary tract infection, and as the age progresses, which is in the older ages, women are almost 10 times more prone to urinary tract infection than men. And beyond the age of 65 years, almost 21% of the women and 12% of the men have the incidence of urinary tract infection. Now, why is this incidence of urinary tract infection more or higher in women than men? Primarily because of two reasons. One is the shorter urethra, and second is because of the close proximity of the urethra to the vulva and vagina. What are the causes of urinary tract infection? A very important and common cause of urinary tract infection is inadequate water intake. We often tend to neglect the amount of water that we consume on a daily basis. Inadequate or less water intake is a very important predisposing factor for urinary tract infections. Second common factor is poor personal hygiene. Withholding urine for longer amount of times. People don't tend to go and pass urine because of various reasons, probably because they don't find a public place suitable when they are outside, or because they would want to hold it and just go, lazy enough to wake up or get up and go till the time they feel the urgency that they cannot control anymore. So because of any reasons, holding the urine in the bladder for a long amount of time, poor personal hygiene, decreased water intake. There are conditions like diabetes mellitus, which is an immunocompromised state which increases the predisposition to urinary tract infection. Sexual intercourse, repeated catheterization, pregnancy is also again an immunocompromised state. Then, going and urinating at non-hygienic places. All these are common predisposing factors for urinary tract infections. Coming to what are the chief complaints? Now, it is alarming that 30% of the population has asymptomatic bacteriuria. That means 30% of the population do not complain despite they having a urinary tract infection, and that is the reason why oftentimes patients come to us when the urinary tract infection has reached to a higher level or a severe level. The other population which complains, which has clinical complaints and symptoms in them, the commonest one are burning urination, may be accompanied, which is with or without fever with chills, painful urination, they might be having a suprapubic or severe pain just above the pubis where the bladder is, backache they can complain of increased frequency, that means they need to go and pass urine frequently, they complain of urgency of urine, and in certain severe cases they even complain of blood in urine, which is known as hematuria. So these are the common complaints. If you experience any of these, please go and see a doctor. Do not self-medicate, or do not take over-the-counter drugs, or do not consult a relative, or do not think that probably last time you have been having a UTI and your doctor has treated you with these medicines, so you can just take them all by yourself. Please do not do that. Whenever you have any complaints, please consult a doctor. We are here to really help you. Each one of us is really here to help you out. Why is it so important to treat urinary tract infections? Why is it important to not leave these urinary tract infections untreated? One, because if untreated, it can lead to severe complications. I'm going to talk about the three major big complications. One is a recurrent urinary tract infections. Recurrent urinary tract infections are found in almost 20 to 25% of the population who leave it untreated, who even after getting treated do not have adequate water, do not have the preventive measures, do not take care of all the preventive measures that I'm just going to mention in the next couple of minutes. So recurrent urinary tract infections is seen in almost 20 to 25% of the population. Second important complication is if this infection ascends or travels up from the bladder into the kidneys, it can lead to acute or chronic renal failure, which is kidney failure, which is a very life-threatening condition. The kidneys can be damaged. And third, very dangerous and a life-threatening condition is the infection passing into the bloodstream and spreading there, going to the various organs, and it is known as sepsis. This is an extremely life-threatening condition. So if you take care of all the preventive stuff that I'm going to mention now, then you can prevent yourself from predisposing yourself to a urinary tract infection, or you can probably prevent yourself from getting complicated as well if you already have it. What are the basic preventions? The single most important thing that we need to be mindful of is adequate water intake. For a normal healthy individual, around 20 to 25 glasses of water per day is very important. If you are already predisposing heart condition, you have it, or anybody has a predisposed heart condition, then please make sure that your water intake is adequate enough according to your physician's advice. But yes, water is the single most important thing that helps to flush out all the toxins of our body, keep our body clean, keep our kidneys clean. So adequate water intake is important. Personal hygiene, personal intimate hygiene is important. Make sure that when you go to urinate at public places, you clean the public place and then sit and urinate or defecate. Fourth important thing is please make sure that your sugar levels are maintained in case if you're a diabetic, or in case if any of your family member is diabetic. Sugar levels in diabetes mellitus have to be really maintained properly to decrease the chances of contracting a urinary tract infection. Repeated catheterization, please take care of your immunity. All these preventive measures have to be taken care of. And I'm going to talk about a couple of important foods that are there which are really good for the kidneys is ginger, onions, your berries, your cranberries, blueberries, your bell peppers, especially the red bell peppers, and cauliflower, cabbage. All these are very healthy food which can be incorporated into your diet, which are good for kidneys. But the most important, as I always say, I'm reinstating this again, that water, adequate water intake is the most important for our health, not just for flushing out the toxins but also for the metabolism and the normal body environment. How do we treat it? The first thing is please do not self-medicate. You do not self-medicate. Please do not take over-the-counter drugs. Do not treat yourself with your previous past memories of a doctor's prescriptions. If you experience any of these, please go and see a doctor. It's beautifully and easily treatable condition with the help of medicines and couple of syrups which are given to alkalinize the urine depending on your blood reports as well. So please get yourself treated. This is something that can be taken care of, and urinary tract infection is an infection which can be prevented to a great extent by doing these basic preventive lifestyle changes in your daily routine. So please do them. And I think I've practically covered everything that you need to know about urinary tract infections as a non-medico. If you still have any complaints, or if you have any of these complaints in the future, feel free to consult me or consult a doctor of your choice who you think would be able to take care of you, would take care of you safely. And again, reinstating, do not self-medicate. Do not leave any problem unattended. Get it evaluated, diagnosed and treated. And if you've really liked this video, please like and share. Your comments are really valuable to me. I'm going to see you soon again with another interesting topic. Till then, you please take care, stay blessed, stay healthy. Jai Hind.